Hi everybody, this is Dr. Habib. I'm here with my friend and colleague, Dr. Seigler. He is our lead clinician at the Living Proof Institute, and I'm really excited to speak to him today in regards to vagus nerve dysfunction and what we find clinically with patients and what we can do about it when we have these amazing findings and what we can make changes for.
Yeah.
So Dr. Seigler is a functional medicine practitioner, and he's also very much in the realm of functional neurology, and he's very interested in making sure that your brain is working well. So first off, his tools are to create an environment that your brain works really, really well in, and then secondly, make your brain work really well. So that's a really, really great tool for us, and this is why I'm very interested to speak with him today about this. So thanks for doing this.
Oh, thanks for having me, man.
All right. So I want to ask you, what are some of the most common signs and symptoms that you notice of vagus nerve dysfunction?
I mean, honestly, usually gut dysfunction. I would have to say the number one thing is probably like a recurring SIBO.
Okay.
Especially because people are really focusing on the bacterial component of things,
Absolutely.
but they're just not getting to the real reason of like, well, why are the bacteria allowed to even be there?
Yeah.
Because we know a lot of the tight junctions, a lot of how those cells work in the small intestine, including the immune system, is under control of the brain. So that's just where we'll typically see a lot of that stuff. And sometimes it might not even be like the bloating and SIBO type stuff, but these a big sign is usually people that they can't really like go to the bathroom all the way and void. So I just tell people, if you can't bench press 300 pounds, you'll bench press 100 pounds 3 times. So you go a little bit, then you kind of wait, then you go back to the bathroom a little bit, but it's not all out, and then you go back to the bathroom. So sometimes these people have to keep going and going and going, because a good sign of how strong the vagus nerve is how much can it lift, how much can it push out of the intestines and really get that bowel motility going.
That's really interesting. So it's obviously the major kind of component of vagus nerve dysfunction is peristalsis, is getting the intestines moving and pushing the bolus through, the food through the intestines. So if you're not having great bowel movements, then that's one of those really pressing signs that there is some sort of dysfunction.
Yeah, and the way that the brain senses that, because the vagus nerve is also sensory, we see a ton of like inflammation and cortisol and catecholamines, so stress hormones, those really start to just change the entire dynamics of how things work. So then that's where whenever I see someone that maybe comes in with like a recurring SIBO and they've been on the antibiotics and all the natural stuff, neem and oil of oregano, and they're like, it just keeps coming back, I just say, if we focus on the bacteria, we're just going to get about this far, because then it's just going to come back again. So that's where we really have to kind of go from a brain to the gut axis if we're going to see long-lasting results.
Absolutely. And you spoke of turning on more of the stress hormones, turning on more of the cortisol, the sympathetic kind of activation. And that's where we notice that there's that imbalance. And if we move towards that stress side, we're obviously taking away from the parasympathetics and thus the vagus nerve.
Yeah, it's like a seesaw. So you can't have both sides up, so either one's on and the other one's off. And it's really about balance, because sometimes people will have like overactive parasympathetics, and these are actually the people that maybe their sympathetics have actually burned out, and they're just kind of like tearing all the time or something, because they're like lacrimation, so tearing, saliva, it's like always more for some of those people. So you can always kind of see there's the other end of the spectrum sometimes.
Absolutely.
Sometimes people don't have enough sympathetics, but for the most part, I say the brain is good at plasticity. That's the whole premise of changing how it functions, but it can get too good at a bad thing, like stress and fear and anger. So really there's a huge psychological component to what we see with how the brain, can't control the guts. And people will tell us, they're like, it's weird, I ate this for dinner, I had it for lunch, and I felt terrible. And they're like, well, I was like, well, what's happening? And they're like, well, my boss is yelling at me, so I'm just scarfing it down. I'm like, do you think maybe that's the problem, not necessarily the food you're eating? So I never really try to blame food. It's the environment that we kind of throw this stuff down the hatch with.
Yeah, absolutely. So the environment makes all the difference in the world.
Yeah.
And speaking of that, we talk about some of the tools that we can use to assess. And so heart rate variability is one of those tools that we know that is a great way to check to see what's going on with vagus nerve dysfunction. Speak to that a little bit.
Yeah, so basically I say in a nutshell, heart rate variability, every bump should be the same distance of time between the next bump, and there should be the same distance of time between bump and bump. So your heart rate should always be bump, 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 bump. So phones have sensors now, like actually that's what I use in my office. I have a Samsung S8, And I'll just have patients like do their heart rate variability, and we'll start to stimulate that system a little bit to see, well, if there's maybe a vestibular problem or an ear canal issue. These are a lot of people, because a lot of people that have like stress imbalances, it's actually an autonomic dysfunction. And these are the people, if they get like scared or like they're anxious in a crowded place, sounds are too much, they don't like too much noise and crowding, that's the vestibular system can't suppress their emotional response. So we'll have people put these sensors on, and I'll just spin them in a chair and start activating their canals. And some people will see maybe a change in heart rate of like 20 beats a minute. Just by, they'll go from like 78 to like one lady was like 112, and we weren't even spinning fast, and it only happened on the right. She's like, so what does that mean? And I was like, do you always feel like you're spinning? She's like, yeah, always the same direction, to the right. So so then, you know, we have to kind of maybe think, well, from higher up, what's also coming down to help regulate those autonomics, as well as the information coming up from the guts. So that's a really easy tool that we use. And the litmus test, usually one of the main exercises we use for the vagus nerve is gargling, but usually people just can't do it. They'll try to gargle and they're just like, and they're like 2 seconds in, like, man, that's it. So we know that from, because I just say, think of, you know, the nervous system is strength of a neuron. So I was like, oh, those neurons are very weak. So
exactly. So activating, it's almost just like exercising. You need to exercise that nerve to make it work. Same idea with any exercise, like a deadlift, for example. If you're not able to do it, then your nervous system is weak to those muscles, and those muscles aren't activated the same way. So
exactly,
similar tool, just a different spot to look into. So that's really cool. So you spoke of some of the similarities that you see with patients that come in with vagus nerve dysfunction, with parasympathetic and autonomic dysfunction. What do you see specifically, commonly, when people have a very specific vagus nerve type of dysfunction, beyond the GI symptoms, the lack of motility in their gut?
Usually, other than the kind of chronic anxiety, I would say usually there's just an unrelenting stress in their life. You know, when we think about stress, it can be your job, because if you hate your job, there's no pill you can take to make your brain forget you're doing something you hate the majority of your day. But honestly, I would say toxic relationships are extremely bad, like extremely, extremely bad. I think that really is kind of something that as clinicians, we maybe don't necessarily always kind of jump to first and address, because stress is always going to just change entirely how kind of every neuron works chemically, and you know, what exactly environment is being signaled to these cells. Like, hey, is this a good environment? You know, so I've seen people with a lot of like autonomic dysfunction, like, you know, POTS is a very prime example of that. And of course, we can do a lot of stuff, but I say, you know, if you hate your spouse, these exercises aren't going to be as effective. It's like, you know, well, I'm just going to take this supplement, but I'm still going to eat like crap. So we really have to address a lot of some of that stuff too. And that's where it can take a team. And really, I always tell people, we're working with people. These aren't just lab results. These aren't just findings on a questionnaire. Like, we really have to figure out, how did these things even get here to begin with for a lot of people? So sometimes the answer we have is, you might have to find a new job. You might have to work from home. You might have to set barriers up for yourself and just say no sometimes. That caregiver mentality, you know, just give to everybody else and never have any left for you. I think that can take a major toll. We all have to recharge our batteries.
We both have cases of patients that have dealt with very similar stressors, these unrelenting stressors that have been going on in their lives. And you said this, and it sparked this idea, or this reminder in my mind about one of the patients that had come in, and I was speaking with her, and she, every time we brought up work, there was this tension that immediately came up in her. Immediately, shoulders went tight, and just face went flush, and all of a sudden the stressor was there. And we realized that there was a really bad relationship that she had with one of her bosses. And this was the biggest issue for her in her health, because that was attributing to this major stressor, was creating this chemical imbalance that was leading to dysfunction in her gut, leading to, and in her case, she did have SIBO as well. She had a lot of gut-related problems and immune-related problems because of that. And so once we were able to eliminate that stressor, she actually was able to go to her work and switch the position that she was working in. She was then able to immediately notice stress, and we were literally working with her for about 2 months. And immediately gut felt better, sleep was better. She got into a much more calm state. She came in and was just so thankful for what had happened, but it was that major stressor that had been there for years and years and years that she just had not been able to address.
Yeah, I jokingly say if you go on the booze cruise and you feel better and your SIBO goes away, you don't have a diet problem, you have an environment problem.
Exactly.
Like a stress problem. Like that's what's going on.
Totally.
So yeah.
Totally. So in terms of stress then, on a biochemical level, we're talking more on the adrenaline, norepinephrine, and epinephrine neurotransmitter side of stuff, as well as obviously cortisol and the adrenals that are constantly being pumped. Talk about the neurotransmitters that are involved in vagus nerve function and dysfunction.
Yeah, so the big one is usually acetylcholine. Because when we think of for most people, well, that's how the autonomics go, from sympathetic and parasympathetic, that seesaw. That major neurotransmitter is acetylcholine, like what's called pre and post ganglionic fibers. So that's a huge one. And of course, we want to see like a lot of other neurotransmitters working. And of course, there's way more than usually the ones people talk about, like acetylcholine, dopamine, serotonin. But those are usually kind of the big three.
Yeah.
There's usually going to be a glutamate GABA dysfunction, like when you talked about the flushing. Usually with a lot of people with stress, we'll also see a lot of histamine related stuff.
Okay.
It kind of comes with the territory sometimes. But that's where usually whenever we think about dietary strategies or what's maybe even a supplement we can kind of go towards, that's really, what neurotransmitter are we complaining about? Are they losing their keys and foggy with no duration of task, meaning they can't focus and they can't poop in the morning? I would probably lean towards acetylcholine. But if it's a cloudy day and they're depressed and then they can't poop on a cloudy day, I'd say probably more like serotonin, that system. Or if maybe someone just doesn't want to get off the couch, and their drive is low, that's very common with a lot of the dopaminergic systems. So really we want to try to figure out what's the chemical switch that's not being flipped on. And that can really dictate a lot of the dietary strategy. Like if we were to go for choline, I'd say like organ meats, most people don't like them, so just buy some liver capsules, make sure they're grass-fed beef, blah, blah, blah. Exactly. Egg yolks are very, very high. Egg yolks are like nature's multivitamin, actually. They're very high in B vitamins, cholesterol, which we know is extremely necessary for neurological dysfunction. Anyone that says like fats are bad, anyone that says good fats in the diet are bad and we should live off sugar, your head is like really in the sand at this point. I think it's overwhelming.
Living about 60 years in the past there.
Usually people that have a dopamine issue, not only do they lack a lot of motivation, usually they crave a lot of meat because they're really trying to get that tyrosine and kind of score some of that so their brain can build a lot of that. And we just deplete dopamine to make adrenaline and noradrenaline. So it's this big catch-22. You're not going to digest proteins because your brain isn't telling your stomach to secrete enzymes, so you're not going to absorb the meat. But your stress system is activated, so then that tyrosine gets depleted to go kind of further down this chain to activate that fight or flight response. And for serotonin, usually these people, they're like the carb cravers, the bingers, especially when we start to see kind of almost addictive type personality to food. Like these people, they're like, I can't give up the ice cream, doc. And, I don't even want to blame the ice cream at that point. I think, what is so bad in your day that the best part of your day is just some ice cream? Because if that's the best part of your day you can't give up, we're totally missing the boat about, dairy-free or whatever. Like, there's way bigger stuff going on psychologically in that association to food. But then we kind of go back to that stress response. The brain, I always tell people, your brain just wants to feel normal. So it's going to try to do whatever it can. Hey, eat this. Hey, do that. Keep sleeping in. To just try to get a footing, really, so that way it can just do what it needs. But I would say probably dietarily, the best thing someone can do really is try to stabilize blood sugars. And of course, that can mean a lot of different things, like ketosis is like the biggest fad on the planet. But I typically don't recommend that type of stuff for a lot of people, because naturally, if we're going to enter ketosis, we're just not going to be a successful hunter or gatherer that day. We just go hungry. We didn't take a sachet of something and drink it before a workout or whatever. So I think we send a lot of mixed signals to our body from a dietary strategy. Like I'll see a lot of people with vagal nerve dysfunction, and they're like afraid of carbs at this point. And women are not having cycles and stuff. And I'm like, just go eat a banana, like don't be afraid. And they'll start, and then they'll like text me a few days later, like, I just had my period, haven't had it in half a year. And I'm like, ta-da, like your body wasn't making a mistake. It never will. We're just trying to really change the environment. So
Absolutely. So environmentally, and the way that we change the environment is through lifestyle strategies. So what lifestyle strategies? Are there anything that you commonly give, any specific tasks that you give?
Oh, definitely. The big thing is mindfulness, because anxious people, which that's very like the number one complaint we see with SIBO and stuff, other than like that vagal gut dysfunction, is anxiety. Like 9 times out of 10, most people come in to see us are for anxiety. So I just say mindfulness, because that takes your mind off of the future, and it doesn't have to be anything. Just like feel yourself being pulled into your seat. You know, maybe close your eyes and listen to the air conditioner on in the room. Be in tune with your breath, because breath is our one window into the autonomics. If I tell you, you know, control your pupil dilation, like challenge accepted, like it'll never happen. But you can control your breath rate. So that's our one conscious way into the subconscious. And that's where we see a lot of breath pattern dysfunction. Some people are what's called paradoxal breathers, meaning, you know, they're breathing in, but their stomach's actually shrinking, going the complete opposite way we might expect. So, but that goes back to like the diaphragm. And that's where, when people think about the core, usually it's the one you can't see, the muscles are usually the ones that are most important. So we see a lot of diaphragmatic dysfunction. So just getting someone in tune with their breath, in tune with what's going on. And I say gratitude. You know, we think about negative emotions like that lady with the job. We could physiologically see a change in blood flow, in the way that her muscles were working, her tonicity. We could see a change in her thought pattern. She probably started to talk different and react differently. But then we kind of, you know, so we see like, man, this is really changing stuff. So if a bad thought can do that, what can a good thought do? And gratitude really is the most, like the strongest positive emotion that we kind of see measured clinically. That and generosity, actually. So what scientists have found is generosity is so strong. Say it's a really terrible day outside and you drop all your groceries, the bag breaks. If it's like raining and I help you pick it up, not only do we feel good about that, anyone in the parking lot that saw it feels good too. So we are kind of a hive mind, you know, we're in this together, whether people like to admit it or not. So I say, find something to be grateful for. You know, a lot of those people, back to the dopamine, they're addicted to stuff. You know, we see a lot of that. And I say, you'll probably be addicted to something, but just get addicted to good stuff. Yeah. You know, so just go give, get addicted to that. Like we picked up trash the other day and, you know, huge dopamine surge. Like it was still clean today, well, cleaner than it was. You know, but just trying to do something to where the brain says, yeah, like that's really good. And gratitude while breathing. So I try to layer in a lot of neurological stuff at the same time, because, you know, who has time to be like in a Zen-like state, like, you know, 4 hours a day? Like we all have a life. So I say, hey, if we can have a thought process, a breath process, maybe even other stuff like gargling or vestibular activation, if that's what people need, and we kind of see that, hey, if we're like firing into this part of the brain, we see it can't pump the brakes and now they get anxious. Like motion sickness is very common in a lot of people, but usually they're also really anxious too. So that's a real big thing that we'll start to see. Okay, awesome. So lifestyle strategies, we're talking breathing, using the afferents, the use of our muscles to retrain what's going on neurologically with vagus nerve activation so that we can get it working correctly. Yeah. Are there any exercises that people can do, anything that they can kind of do on their own at home, very simple ones? Yeah, I think gargling is probably the most well-known. Singing, you can even go yodeling if you want to. You know, there's that kid in Walmart. So anything really that's really going to activate a lot of the vagal nerve, but actually sometimes, like if we see a stroke patient, that's where sometimes the gargling is not going to work. We might have to be more aggressive with like gagging or coffee enemas. So again, like strength training, say think of gargling like jogging, think of gagging like sprints or something like that. So sometimes we'll have people just gag themselves with their toothbrush. We've actually had you know, toddlers and stuff in the office having some swallowing type dysfunctions, and that's what stuff that we would actually have to do. So sometimes it's not always fun to try to do these things, try to stimulate the nervous system. I mean, if people really want to stimulate the vagus nerve, that's why gagging works so well, but throwing up is probably one of the biggest ones. And, you know, people cry a lot whenever they throw up because we see just so much activation in the brainstem. It's like such a strong response. But but gagging is not really fun. A lot of people do gargling, but I'll try to say, actually, I really like a lot of cold showers.
Okay.
So that in the short term, it's a fight or flight response because your body thinks it's like, oh my God, we're freezing to death. We need to burn some fat. We need to change. Let's get some noradrenaline kicked up so we can get the frick out of this water. But then we kind of start to see in the long term, it resets that vagal tone. Yeah. So now there's like less of a stress response in like traffic or an argument. Because I just jokingly say, compared to freezing to death, driving through traffic's not that bad, and your brain realizes that. So maybe while someone's like in a shower, they can do some deep breathing, they can think about something they're grateful for. So now we see a thought process, we see a motor pattern, and most people that can't breathe in, it's because they can't breathe out. I can't flex my bicep anymore if it's here. The only thing I can do is bring my shoulder up. Yeah. So if I can't breathe out through here, all I can do is kind of move through the chest. So we'll actually have people breathe out and really teach them how. So I say, imagine you're blowing out candles through a straw and you just...
Interesting, okay.
And then breathe in, because you have to let that diaphragm go all the way down before you can get another contraction up.
For sure.
So that's when people I feel like I can't breathe deep, I can't catch my breath, like that's a big sign. So we'll kind of start to layer some of those things. Yoga is huge, and yoga is not even, yoga is doing poses, but true yoga, in my opinion, is really the focus on the breath. Because that's where, if you notice, if you go to like a good yoga studio, they always get you centered first. Yes. Hey, feel yourself on the mat, like we were talking about. Become present. Be aware of your breath. Let's start breathing in a parasympathetic state, so that way we can change blood flow to the brain, blood flow to the guts, blood flow to the extremities. Like we see a ton of cold fingers and hands. Yeah. Just because we don't have enough blood to be everywhere at once, and that's all under control of those sympathetics. So we'll see like changes in blood flow when we start working. People go, oh my God, my toes are warm again, doc. And we're like, oh, that's really cool, and you're probably pooping better too. Yeah, how'd you know? It's like, well, that's the way the body works. When you know how it works, you know what to expect when you do the right thing. So.
That's perfect. So when we were talking about the activation of the brainstem, we're activating specific nuclei. And one of the very specific things that you need to do when you're gargling is not just gargle and sit there and do it. The point is to activate it to the point, or gargle to the point where you actually start to tear. And why does that work? What nuclei are being activated?
Yeah, so now this is where you, the fun thing about functional neurology is you got to know the names to play the game type thing. So we have what's called the nucleus tractus solitarius. Okay. And that's kind of like kind of the command center for the vagus nerve, really. And he is kind of, his office is right next door to a thing called the superior salivary nucleus. Right. So that's where, if his office is on fire, this office is probably going to catch on fire too. So that's why I tell people. So that's where we see kind of what's like a co-activation almost of certain symptoms. Okay. Like we were kind of talking about earlier. That's when people throw up. They're like, oh my gosh, why am I crying right now? Yeah. So we'll kind of see that, especially sometimes even after a real big, because sometimes when people, they get dizzy, they throw up. Yes. And then we see them tearing and they're like, man, I was sweating and then I threw up and then I felt better. Yeah. So we see a big sympathetic, oh, I'm sweating, I'm anxious, my heart rate is just going crazy. I throw up, wow, okay, now I feel better. Because we just, boom, we hit that vagus nerve so hard by activating that actual like vomiting. Because, the gut's a one-way street. So to make it go the other way, we have to see a huge change in how the brain is controlling motor function inside the GI tract.
Yeah, I actually hadn't thought of that. That's pretty interesting. Speak to humming and chanting. Why do those exercises work really well when you hum deep in your larynx or deep in your throat? Or chanting, why do they tend to activate the vagus nerve so well?
Well, a big thing is if most people know how to breathe, then they know how to sing and hum and do things through here instead of up through here. Exactly. But we see a lot of vibration in the vocal cords and things as well too. So that's where, honestly, if you look at a lot of religions, there's a lot of different stuff like that, a lot of different chants, a lot of different ohms and things. So we kind of see a lot of broad similarities with things. Give thanks before your meal. Be nice to people. Like very common similarities have been passed down through like thousands and thousands of years. And honestly, I think it was what our ancestors find was kind of a big way. Like, man, we can reset vagal tone by doing some of this stuff. Of course, they didn't call it vagal tone, like you're speaking a language that hasn't been written yet. But they knew a lot of this stuff would happen. And honestly, I think we're just way too disconnected from nature anymore.
Yeah.
Because we're not present anymore. People are always somewhere else, just scrolling away. I mean, you get on the elevator, people can't even focus for like 15 seconds. They just immediately get on their phone. They can't have a conversation. They can't just not try to stimulate their mind. The brain's always like reward-seeking behavior, basically. Okay. Like we see it with autistic kids in stimming. They're like, oh, my kid just likes to spin in a chair. They want me to hug him real deep. So we see a lot of that. But like we're literally addicted to all of these other things. And what we know, like even just looking at a screen, the blue light changes how things go. It changes enzymes, the vertical eye movements start to secrete dopamine. So we just see, anyways, it's just so nuts. So for a lot of people, we talk about detoxes for all these things. I say, when's the last time you just didn't look at your email? You didn't look at your phone. Just spend a day hanging out with your family. You know, to me, that's like the best thing I've ever done probably for my health is on Sundays. We call it a no technology day. We don't look at any screens. We don't do anything related to technology. We just hang out. We'll color. My daughter's about to be 5. You know, we'll go outside and play. She's big into like nature, so we like to find worms and put them in the garden and stuff. So just really connecting though, but we're back to being present. Really kind of, we're meant to be part of this world. And I think the more dissociated we get, the sicker we obviously are. We're just dying of different diseases, you know, in these developed countries, we're living longer, but the quality of life, frankly, it sucks. Like, the last thing I would want to do is live to 90, but I died at 60, you know?
Absolutely.
And that's where, back to the stress, we see a lot of just kind of chipping away at the brain, that chronic stress response. And over time, it just keeps degrading and eroding, like, the brain as a whole.
It's very terrible that we realize that we're so disconnected, and even just being on our screens disconnects us from presence and just being mindful of where you are all the time. Meditation is also a really great tool, I imagine, and some religions use it really strongly, some religions less so, but whether it's a religious or a spiritual idea, the idea of meditation has a lot to do with breath and coming back to centered and presence. Speak about that a little bit.
Well, in meditation, to me, it's always, well, what are you meditating on? Because people are like, oh, meditation's bad. I'm like, but if you're meditating about how you can do good for people or how you're going to have a successful day and manifest those things, like, why is that a bad thing? But if you're meditating on, you know, bad stuff, well, yeah. So, yeah, back to that breath and mindfulness, but really the thought process. You know, we talk a lot about food, especially when people are complaining of vagal nerve stuff. But if you only eat 5 times a day, you only poison yourself 5 times a day. But if you have like 5,000 bad thoughts a day, I don't know a pill that can change that. So we really have to try to balance those scales with just, hey, let's just have good thought processes. Like a big thing we do around our house when we eat dinner, we just ask our daughter, who was nice to you, who were you nice to, and what was the best part of your day?
That's awesome.
You know, so that way we just kind of start focusing on the good, you know, because like the diet's funny. People ask, well, you know, they ask our patients, are like, hey, can I eat this? And I just tell them I can find anything wrong with any food if I dig hard enough. But at the end of the day, like, we shouldn't have to be like cowering in fear from all these things. I
think one of the things that we do in practice and functional medicine in helping patients deal with a lot of their chronic stress, we attribute a lot of the issues to food, and I don't think food has as much of a pull or as much of a negative impact as we think it does. There's a lot more other factors going on, lack of presence, lack of breath, and so those are really important to factor into this and to make sure that it's not all about food. Your vagus nerve isn't just pulling you know, nutrients out of your gut. There's more to it. And so making sure that it all works correctly, the full system works correctly. And we just have that one avenue of vagus nerve, and that's an important one to activate. But it has to do with the entire system working really well.
Oh, absolutely. I mean, when you look at like all-cause mortality risks, when you start to compare people with diets, there's really not that big of a change in number 1 versus number 2 versus number 3 versus number 4. Like, how we die is still pretty much gonna, I don't want to stay the same, because obviously I think I'm on a completely different trajectory, my wife, my daughter, than when I first started applying a lot of these things. But to me, it's the quality. You know, I'd rather, if I die at 60, we don't know our time, then I'd want to make sure it was a full life at 60 instead of just some crappy life at 90. Because at the end of the day, time is really an invention when you think about it. Who says a second is a second? We do, because we all agree on it collectively. So, not to get too woo-woo or anything, but we're kind of talking about meditation. But I was just reading about that monk that set himself on fire so long ago. It didn't move a muscle. So our reality is really our interpretation of events more than anything. And if we can change our brain's interpretation of stuff, now we've technically changed reality. And I think that's like when we talk about drugs trying to do better than the placebo effect, it's extremely hard to find something that works better than the brain thinking it's helping the body. So that's where when I say I'd rather have a placebo effect more than anything, give me a good thought process. Because that's like the strongest thing in medicine that we've been able to find, really.
Yeah, absolutely. That's amazing. Speak to any interesting cases that you've noticed, people that have come in with parasympathetic dysfunction.
Yeah, there was this one lady, she had a thing called vasovagal syncope.
Okay.
So what that happens is they stand up and blood pressure kind of drops in your noggin, and you're supposed to like raise your heart rate, like let's get that blood in the brain so we don't pass out when we stand up. But theirs just kind of keeps beating slow, so it can't sense that. So we set her up on this heart rate variability monitor on my phone, and it was just like a polygraph. Her heart there was no bump, it was just blah, 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 all over the place. And I was like, hey, let's just play a game. So we spun her in the chair, no change in her heart rate. So I thought, okay, there's not a vestibular component. And so then I was like, let's just gargle some water, because I was noticing her breathing patterns were kind of bad. And when you gargle water, you hold your breath, actually. So there's still kind of that pause we know in breaths is big, too. So we just had her gargle for like 20 or 30 seconds and put her back on the heart rate variability, and it was just like bump, 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 bump. So the beauty about neuroplasticity is it happens real time.
Yeah.
So I always tell people, it's not like if we just gargle for 20 seconds, it's like all this bad stuff that happened to you never happened. I was like, but now we found a tool that works.
Yes.
And just like an exercise, the more you do it, the better you get at it. So just do it, because we'll do these things with patients with the brain, and they're like, oh my God, I'm writing better. Oh my God, I didn't get dizzy. Or oh my God, my heart didn't beat fast. What happened? Yeah. And I'm like, they're like, what do we do about it? And I'm like, we just did it. Like, just keep doing it, and you get better. And maybe if we fire too much into one side of the brain, it'll fire maybe forward into a different part, what's called pre-neuronal pooling. Okay. And so maybe that part of the brain can't handle it. So of course we want to reevaluate and make sure everything's kind of working synergistically, and we're not like creating more of an imbalance in the brain. Because there's always that effect too. Yeah. So you can gargle, but I don't know if we were like, from a brain perspective, I don't know if we're designed to gargle like 30 minutes a day. In reality, like who would do that like 1,000 years ago? I always try to think, what would we do without technology? Yeah. Without the store being around the corner. So I think that's a real big component as well.
That's amazing. I want to thank you very much for doing this.
Thank you.
Appreciate it.
Yeah.
And I want to share with all of you that Dr. Seigler does have a brain boot camp program that he is going to have online and share with all of you, and I'm happy to share that with you through this talk today. Thank you so much again, and I really appreciate this.
Yeah. Bye, everyone.
Bye, guys.